And, all right, let's go ahead and jump in. Um, so today we just have a couple quick announcements. I'll go over the data, and then we have some really great information from our community health and food safety team about norovirus. Unfortunately, COVID's not the only thing going on, so we'll have some information today on norovirus as well, and then Q&A at the end if we have time. So first announcement, we continue to have a good supply of test kits for schools. The test kit market has really loosened up quite a bit, so we've been able to procure more. So definitely go ahead and put in your order. We have both the kinds that require a CLIA waiver as well as some home test kits. So put in your request if you would like some test kits. Also, we have some packages headed out to schools, so I'm going to hand it over to Matt real quick to make an announcement about that.
Hi, everyone. I just wanted to give you all a heads up that some packages might be arriving to your schools either later this week or in the next couple of weeks. The same grant funding that allowed for us to connect the school staff with behavioral health supports these past few months, we've been able to extend to some other resources. And so this includes
it has to be a really big issue. So you have to think about whether what you were getting out.
You muted the wrong person. So in these boxes, you'll find a few resources that we're hoping will be helpful for students that have been impacted by COVID. Depending on the age of the students that are at your school, you'll find one or two different workbooks. Both of them have to do with kind of navigating thoughts and feelings and emotions surrounding the pandemic. And then for the older students in middle school and high school, we're also including some information on the Text Talk Act program. It's a mobile texting activity that youth can engage in to kind of get introduced to what is mental health, what does it mean, what are we all talking about, and then if they want to seek services, it'll tell them how to do that. It includes some really great videos from teachers, it includes videos from their peers, and so that's a really great activity. We've also included these resources on a new website that we developed. We're trying to kind of create a page for other mental and behavioral health resources for students and caregivers, as well as educators. And so I'll go ahead and link that webpage in the chat. Feel free to check it out. We're adding to it. It'll be around probably for a while. And so if anyone has ideas for other resources that we can put on there, we'd be more than happy to include those. Thanks.
Perfect. Thank you, Matt. So be on the lookout for packages like this. It may be a box or it may be an envelope. So have your front office staff be on the lookout. Also last week, we did not send out a follow-up email last week because I was away for some time, but we will include all the resources from last week's call and this week's call in our email today. But just to let you know, there is a new scheduling tool for vaccine clinics, so you can click on the link, and for more information, you can watch our school's call from last week if you missed it. All right, COVID-19 data update. So as of March 22nd, we are in moderate transmission, so that's correct, sorry. But we are, for community level, we are now in a low community level, which is great news. Our rates had dropped very low, and then last week we saw an increase. But this week they've remained pretty steady. So last week we had 812 new cases for the 7-week total, or 7-day total, sorry. And this week we have 816, so it's pretty steady. That's 77.92 cases per 100,000 people. Our test positivity has continued to decrease, which is great. So only 3.45% test positivity, and over 72% of our population that's over 5 years old has now been fully vaccinated, which is great news. For schools, the cases are super low. So the cases that are being reported, this is for the past week or so. Very few cases, not sure what happened on the 22nd, but other than that, the cases remain low in schools. So for our community levels, here's a reminder, here's the metrics that they use, and then also our hospital information is below that. This was updated in the last couple days. So our new admissions per 100,000 that have confirmed COVID are 3.9, which puts us in low. And the percent of inpatient beds staffed inpatient beds with confirmed COVID positive is only 2.5%. So that also puts us in low. So that's great. We believe that we'll stay in low for some time now, unless our cases begin increasing a lot. So what does low mean here is the mitigation that's recommended by the CDC for low community level. And then as a reminder, here is the link to the community levels overview web page, as well as the CDC data tracker. They are still two separate web pages. So there are the links. And now I'm going to hand it over to Lauren from our Community Health and Food Safety team to share some information with us today on disinfecting and cleaning after viruses other than just COVID-19. So Lauren, feel free to take it away.
Thank you. Anissa Taylor from our epidemiology division is actually going to be presenting on the first portion of the slides because it's more epi-related information, and she has a really great way of breaking that stuff down. So go ahead, Anissa.
Perfect, thank you.
Hi, good morning, everyone. And Kat, are you going to be moving the slides?
Yes, I will do that.
Okay, wonderful.
Just let me know when you're ready to move on.
Great. Lauren did put together this great presentation, so I'll talk a little bit in the beginning and then she can take over with her expertise from there. So today we'll be talking a little bit about noro. Next slide, please. So as you may not know, norovirus is what we typically call stomach flu. It can be a mild, acute self-limiting illness. However, with special groups, and we'll talk about that a little bit, it can be a little bit more severe depending if someone's immune compromised and elderly. But for your age group in the schools, it's pretty mild. It's just very acute and it doesn't feel mild when it's going on. Symptoms typically include vomiting, diarrhea, nausea, stomach pain, a lot of times fatigue. Now with children, we tend to see more vomiting than diarrhea, and adults we see more diarrhea, but either or are common. Outbreaks are very common. It's a very hardy disease. It's a sporadic disease and it can live on surfaces for quite a while. And Lauren will talk a little bit more about that. Next, please. So outbreaks can occur anytime, but we tend to see outbreaks that we investigate or that are reported usually November through April. A lot of times travel's associated with that. I mean, we've actually had cases where we were able to track children who've had it, over winter time, visited their grandparents in the nursing homes, or parents who worked in the nursing home setting, took it home to their families and vice versa. I want to say maybe it was like about 6 years ago, we had a really, really big outbreak that went through nursing homes, elementary schools, and the healthcare setting. So that was really interesting to trace those cases. So keep in mind of that during this time of year, especially. Next, please. Oh, okay. So there's a little bit of, so norovirus outbreaks, again, as I mentioned, are pretty common. So this was data previously, we had 900 deaths. Again, 65 and older is a really susceptible group. If you think about high touch surfaces, really good hand washing is important in preventing that because sometimes they can't see very well. They're touching different things, touching food. And so it can cause extra hospitalizations. It can cause visits to the emergency room, especially in elderly and young children because of the dehydration. And again, the acuteness of it. the vomiting and the diarrhea illness, if they have something else going on, can be really detrimental to them. So these again are just the numbers. And I also pulled up numbers recently. So unfortunately, when we find out that it's norovirus, it's really only if someone gets tested. Our assisted living centers, we've been working with enough to where they can send specimens, but schools, it's really hard, right? You don't know that someone has norovirus or suspected until after they've already maybe gone to the restroom or had a vomiting accident. So it's hard to collect specimens because it is so acute. It'll come on really strong and then go away. So we don't always get that opportunity to collect specimens. So for instance, in 2021, we had 10 outbreaks that were reported to us, but they were diagnosed as unknown GI illness, where we had 2 confirmed norovirus outbreaks, but they're both from assisted living because those people were there. I mean, a nurse will have the specimen collection tools to take care of that. So again, we will usually associate unknown GI illness with norovirus if it meets our case definition, if it looks like it's that acute vomiting and onset of diarrhea for a certain amount of time. So keep that in mind. Next, please. Okay, so this is really kind of scary information here, but we have some information here that, again, it's more likely to have an outpatient or emergency department visit. By 5 years of age, 1 in 110,000 could die from norovirus. 1 in 160 will be hospitalized. 1 in 40 will go to the ED, and 1 in 7 in an outpatient clinic. So although we see lots and lots of these cases, we still want to be cognizant of those small percentages that could really suffer from this illness. And so being aware and doing the right mitigation efforts are going to be really important. Next, please. So why do they occur? And Lorna can talk a little bit more about the restaurant side, but as we know, norovirus is a very, very contagious virus in terms of its efficacy from fecal to oral. Just a small amount of the viral particles can really cause a great infection in someone. And if it's a virus that sits really well at surfaces, a food handler, someone who handles the diapers, so again, healthcare facilities, daycare, childcare, maybe even settings where there's disabled people or seniors using diapers, that's a really great opportunity for this virus to spread. And it's hardy virus, so this is what we hear about on the cruise ships. This is what we hear about when people travel. So if you think about those populations that are traveling and visiting, again, family and friends during the holidays, that's when we really see it take off. And then it kind of continues into the spring. Although, again, a person can get this any time of year. I've read data sources from the CDC that it can be rehydrated. So if it's out in the sun, if you have, that virus sitting out there, gets picked up by a person's hands, transmitted somewhere else in a moist environment, there you go, it's a viable virus again. So again, really good deep cleaning is important, and we'll talk a little bit more about that soon. Next, please. So it is the leading cause of outbreaks in contaminated food sources in the United States. Infected food workers are frequently the source of outbreaks in food service settings, often again by touching ready-to-eat food. So it's a little bit different than, say, a salmonella or a campylobacter, where it's actually like, say, the food source itself. It's more from frequent touching of the surfaces. So again, any type of either ready-to-eat food, I mean, we're talking doorknobs, utensils, anything that you're touching could be problematic for norovirus. Next, please. So schools and childcare centers. Out of the data that I mentioned, I just wanted to give you a little bit of a summary. So out of those 9 unknown GI illnesses, 5 of those were associated with schools and or childcare centers. A couple of them were associated with shelters. Again, that can be all age groups. And then other unassociated would be like community events, community residential homes, that kind of thing. But again, we would classify a known GI illness that fits that case definition under the schools and the childcare centers. We see a lot of that, right? One kid is vomiting across the room, then we see another child, and then the next day another child, and it just spreads like wildfire. And then the teachers and the janitors will have it because they're cleaning it up and not wearing proper PPE while cleaning, vomitus. It could be aerosolized. So again, that's really important to keep track of these cases and report it to the health department as soon as you suspect it. We have lots of education tools and mitigation efforts to help you in these situations. Next, please. Prevention strategies. So a big thing is not to go to school or to work when you have these symptoms. So most people will still carry it in their system, in their stool, for a couple of weeks. It's been documented. However, we recommend at least 48 hours until after symptoms stop. If you're a food service worker, 72 hours. So that's until after your diarrhea stops. We still want you to stay home. Don't prepare sandwiches for anyone at home. With children, if you have small children, or you could talk to your parents about really good hand washing under the fingernails. Same with senior citizens at home too. Making sure really good hand washing, cleaning those surfaces. These are all different symptoms that would be of concern for food service workers, especially. They're not all necessarily for norovirus, but in particular, vomiting and diarrhea is the number one thing. If you have any of these symptoms, you should definitely not be handling food or being at work or around small children or senior citizens. And I believe the next slides are going to be more of our mitigation efforts that Lauren's going to take care of. Thank you.
Thank you, Anissa. Alrighty, so if you want to go back one slide, I think back a few more slides. There we go. There we go. That's perfect. So also especially during an outbreak, we would want food handlers to inform the person in charge of symptoms that they're experiencing, as well as if someone in their household has symptoms of foodborne illness or a foodborne disease diagnosis, because they would, like Anissa was saying, need to stay home for the appropriate amount of time. Norovirus is stable in the environment and can live on all these surfaces that you see listed for prolonged periods of time. According to the CDC, it's up to 2 weeks, but it can go longer than that. It's just 2 weeks on average that it'll sit on these surfaces and can remain infectious. And we did get a question in the chat about those cups and lids that are out that everyone can touch. So there's usually a hand sink that's provided at some of these gas stations. So it's kind of hopefully your own hands are clean when you're handling those single-use equipment items, because there's no way to clean it afterwards. It's just not going to hold up to any kind of disinfection or cleaning. Frequently touched surfaces, also known as high touch points, such as tables, door handles, light switches, handrails, bathroom areas, water faucets, classroom desks, and then playground, play equipment, and that's all stuff that should be cleaned and disinfected frequently with a product that's safe to use on the type of surface that you're disinfecting, and is effective against the specific virus that you're trying to disinfect for. Next slide. Right, so disinfectants must be checked to see if they are effective against the specific virus that you're targeting. It's important to know the contact time that it takes to kill that specific virus. So it's going to be different depending on the concentration of the product you're using, because a lot of chemicals you get from your chemical company, and they put it through a system and there's a dilution process. So you want to know what strength you're working with so that you can adjust the contact time. Cleaning products such as Lysol or Clorox wipes, they might be labeled as Clorox, but a lot of times they are quaternary ammonia-based products, which may not be effective against norovirus. This is because Lysol sprays and Clorox wipes indicate that there's a 10-minute contact time for killing norovirus. So if you've ever used those wipes, the surface dries pretty quickly and definitely does not stay wet for the 10 minutes. Personally, I've seen the surface stay wet for about 2 minutes if it's a small area, but usually you go through quite a few wipes to keep that surface wet for the full 10 minutes. We recommend using quaternary ammonia on food contact surfaces of equipment, such as food service utensils, baking sheet pans, pans for cooking and reheating, anything that's food equipment. But to disinfect high touch points in the cafeteria, such as tables, we'd be using a different disinfectant so that we're disinfecting the surface in between each student or each lunch wave, especially during an outbreak. Quaternary ammonia most of the time is not considered an effective product for disinfecting for norovirus. Many of the EPA registered quaternary ammonia products that they're not listed on the EPA's list of products that are effective for norovirus. The ones that are have a 10-minute contact time. And again, it can be difficult to keep that surface in contact with the disinfectant solution, so wet, for the 10 minutes. You usually have to do some type of reapplication. And during an outbreak situation, you want to lower that contact time. So we'd be looking for you to use a product that has a lower contact time. Next slide, please. Alrighty, so one of the first things that you can do is you can make a plan. You know your facility best, you know what surfaces are in the area that you're responsible for disinfecting. So you want to start with a normal cleaning procedure to ensure that dirt and debris have been removed so that the affected area can be effectively disinfected. If we have food soils and protein buildup, grease, the disinfectant isn't going to be effective because the surface is dirty and it breaks the product down. So you want to use a product with an EPA registration number to start when you're planning. Look for that EPA registration number. If it doesn't have one, we wouldn't want you to use that product because, again, it's not registered with the EPA, which means that the label doesn't contain the information that you need to effectively disinfect. So you want to confirm the product is an approved disinfectant. And if you're talking about norovirus, we'd be looking at the EPA's list G. And it should be listed on the EPA's website as a product that's registered to kill norovirus. The other alternative is you can look for, but norovirus is one of the most durable viruses, which is why during COVID, the original EPA's list didn't say that the products were effective for the SARS-CoV-2 virus, but rather we're likening it to norovirus, which was already labeled as a virus that was harder to kill than SARS-CoV-2. Next slide, please. Ready. So you want to follow the steps of your plan. That would include the routine cleaning and disinfecting throughout your facility. Follow the contact time that the product should be on the surface for proper disinfection, and that's going to be based on the product label. Disinfectants taken from larger containers and put into other acceptable containers, such as those chemical spray bottles. And you really want to avoid reusing chemical spray bottles. They need to have a label with the disinfectant name. Because we have a lot of products that are used in different areas, it's not a bad idea to label it with the designated usage area, as well as the concentration, because if it's just bleach water, but it's extremely concentrated bleach water, that's not something we want to see you using in the kitchen on food contact surfaces, unless you're doing some type of post rinse. So if your facility has multiple disinfectants stored on site, the concentration and the designated usage area need to be included too. Store chemical disinfectants in accordance with the manufacturer's instructions in a designated area that's not directly above food contact surfaces or food preparation equipment or where food's stored, and definitely in an area that's out of reach of children. Securing the lids on there and turning the spray nozzles to the off position is also going to help with keeping the product at the required concentration. Make sure that you train employees on the cleaning and disinfecting procedures. Notify the employees that the procedure changes. And employees should be educated and trained to use chemicals appropriately and in accordance with OSHA's hazard communication standard. And then you'd want to provide all the necessary personal protective equipment so that they can safely do this disinfection process. Next slide, please. So the last step, manage and change your plan as needed. I'm sure that everyone here knows that the plans change, products might not be available, the ones that you were using before, so maybe the contact time changes. So continue updating the plan and procedures as guidance for your facility type changes. Revise your plan if you can't properly implement the procedures, and educate your employees on those changes, because sometimes not everybody knows that you have a different product and that there's a different procedure to that product. So also, if you're not sure, based on reading the label, you can always direct further questions regarding disinfection information to the chemical manufacturer, whoever comes and drops off those chemicals to the cafeteria area, or maybe where the mop sink is storing some of the chemicals for cleaning the floors. You can get in touch with the chemical manufacturer just looking at the label to ensure that we're using that product safely and appropriately according to what the EPA label says. Next slide, please. So disinfectant products may be marketed and sold under different brand and product names. In order to determine whether a given product is effective to kill norovirus and or SARS-CoV-2, that's the virus that causes COVID-19, you need to determine whether its primary registration number is on the EPA's list of products that are effective for your virus. So we have two lists that the EPA has provided. We have list N, which is for SARS-CoV-2, and then we have list G, which is for norovirus. So regardless of whether you are using a primary registration product or a supplemental distributor product, always check that the product's label includes directions for the specific pathogen you're trying to destroy. For example, if list N indicates that a product will kill SARS-CoV-2, you need to follow the instructions that the EPA's website says you should follow on the label. And we'll talk about a specific product on the next slide to make this a little more clear. So this is what the list N tool looks like. Sometimes we have products that have 3 EPA numbers. You would just be putting in the first 2 sets of numbers. You don't need to put more than that, or you won't find the product that you're looking for on their website. And if you want to go to the next slide, we'll see an EPA registration number so you know what you're looking for. So this EPA registration number is 1677238. It's a peroxide-based disinfectant that is effective for norovirus. When you are trying to disinfect for norovirus, you can use either the N tool or the G tool. There are some options there. The N tool is a little bit more robust. Let's go to the next slide. So if we were to put 1677238 into that search bar, this is what the screen would look like. It tells you follow the instructions that are on the label for norovirus disinfection. Even if in this example, you're trying to destroy SARS-CoV-2, it gives you the virus that you would want to read the label for. Follow the preparation instructions, like how you're going to dilute the product. It'll be full strength for this example. And then it also lists the contact time, which is 2 minutes. It also says for surface type hard, non-porous. If it doesn't say food contact surface, you shouldn't use it on a food contact surface. I've reached out to Ecolab for this product specifically, and you just would be doing a post-rinse procedure to render that surface safe to prepare food on. In the event that you did have a worker that was in the kitchen that had norovirus and you did have to go in and treat some of those countertops and things that they had touched, because maybe they were working and they weren't feeling well and they went home, and we took the appropriate actions. We still got to clean those areas where they were. Next slide, please. So this is just a close-up of what the columns are showing. So again, the label on your actual product is going to have your EPA number, and on the back it's going to have instructions for different types of disinfection. And really the end tool tells you what directions you want to refer to on your product label in order to safely disinfect. The end tool is also going to give you the contact time, and that's really helpful. But the instructions on your product label are going to be more specific. If you have like a food contact surface, it'll tell you to do a post rinse if it is safe to use on a food contact surface. But it wouldn't be safe to use unless you did a post rinse, because it's going to leave some chemical residue behind, because these are really strong products. We haven't used disinfectants in kitchens before. We really rarely did that. It wasn't until the pandemic that we got really used to seeing those products throughout facilities, including in food preparation areas, which is why the labeling is so important. Next slide, please. So this is just a basic dilution instructions from the CDC for bleach and water. So some products might be harder to come by if you're in the middle of an outbreak and you can't get a hold of enough products to use to safely disinfect all these high touch surfaces in your school. This is just one of the many options that should be pretty available to you. But the main thing about this is that we're using 100 to 500 times the concentration of what is what's safe to use on food contact surfaces. So you're making a solution that's up to 5,000 parts per million to kill norovirus. It's got to sit on that surface for 10 minutes. And then because it's a really high concentration, if we did have to do this process in a kitchen or food prep area, then you'd be doing a post rinse with the same product if we're talking about bleach, and it's going to be different depending on what products you're using. So you don't want to mix chlorine bleach and quaternary ammonia because that makes chlorine gas. So it's a really dangerous situation. You don't want to mix chemicals. And that's why if you're not sure, you can reach out to your chemical provider and find out what products you can use to do a safe post rinse. So if it is not a food contact surface and it's just a high touch surface like a doorknob, then you would just let that disinfectant sit on the surface for 10 minutes. You might need to reapply at the 5-minute mark, but no post rinse is required. Next slide, please. All right, so the main thing on this is just sort of a response checklist that we send out to our schools to help with outbreaks. And one of the most important steps in here is that we're ensuring that staff is cleaning up any vomit or fecal accidents using the appropriate procedure. We really don't want you to use to reuse a mop to clean up a vomit or fecal accident. The mop heads, depending on the type of mop that you're using, is just not going to be easy to clean. There's not a lot of products that the EPA has out there right now that are safe to use on soft, porous surfaces like the fabric of a mop head. And depending on how it connects to the actual mop handle, that stuff can be really almost impossible to get properly cleaned. It's possible, depending on the condition of your mop bucket, that you can safely disinfect that. But try to use as much single-use equipment as possible, especially during a norovirus outbreak. We'd be looking for you to mask up. Next slide, please. We pass out during our inspections a vomit and fecal accident cleanup procedure. So if you're ever there for an inspection. We always have that stuff if you guys need that guidance. About 50% of all outbreaks of food-related illness are caused by norovirus. But again, a lot of norovirus outbreaks, in the very first graph that we showed you guys, there were 2 actual trend lines, and the food one was kind of just consistent all across the bottom. So we have food-related norovirus outbreaks all year long, and it stays pretty level unless there's been some type of event and we had someone work in that event while they were sick. All right, next slide, please. So these are the 2 tools. They're just QR codes, or you can just go to the EPA's website, type list G, and then the other one is list N. Both are going to be helpful because both locations have norovirus disinfection as an option, but list N is a little bit more robust. If you want to go to the next slide. And if anyone would like to participate in this, it's just giving it a shot. So you take your smartphone out, you scan that QR code, it takes you directly to the EPA's website. You put in just the first 2 digits of, this is a quaternary ammonia-based product. So the digits are 683673. And if you were to try this activity, what you would see is that this is not an EPA approved product to disinfect for norovirus. And it also happens to be a quaternary ammonia based product. It's concentrated, it kills 99.99% of germs. And the problem with norovirus is that we can wash our hands and do a pretty good job, but it's still going to remain on our hands. So that's why in Pima County, we don't allow any bare hand contact with food, because if you have someone in your household or you don't necessarily realize that you have kind of like some loose stools, you might have norovirus, and that's why we don't allow bare hand contact with food, because it can be spread so easily through that method. If you want to go to the next slide, it's just some resources that we used to put this PowerPoint together for you guys. So hopefully we kind of made it a little more clear on how to navigate that EPA registration number using those 2 websites. That's what we use to determine if you guys need to do like a post-rinse procedure. Does anyone have any questions?
Thank you so much, Lauren, for joining us today. I will send out these slides in our follow-up email. We are over on time, so I'm going to go ahead and wrap up the call. But there are a couple questions in the chat, and so we will get answers for you and put those in our follow-up email as well. So thank you, Lauren, and thank you, Anissa, so much for your presentation today, and we will see everyone next week.
Thank you.
Thanks so much. Have a great week.
Thank you.